Lower extremity palpation, lab 11. Bones of the foot, posterior leg, plantar surface of the foot. The bones we will be identifying: metatarsals, 1 through 5, the tuberosity of the navicular, the medial cuneiform, the talus, and the calcaneus. Before we leave the skeleton, we will be doing on the patient a series, an organized method to locate many of these bones. First, you will be finding and locating the medial malleolus. Next, place digit 2 just below and in front of the medial malleolus. This will be the talus. Next, place digit 3 just distal in front of the talus. This should land on the tuberosity of the navicular. Next, digit 4 is placed distal to the navicular on the medial cuneiform, and your 5th digit falls onto the base of the first metatarsal. Now on the patient. Metatarsals. You will need to palpate the base, shaft, and heads of metatarsals 1 through 5, and palpate the heads of metatarsals 2, 3, and 4. The heads of all metatarsals can be found by having the patient flex their toes. The heads of each metatarsal should become obvious. To find the base and shaft of digit 1, we will also locate the navicular tuberosity and the medial cuneiform and the talus in the method shown on the skeleton. First, locate the medial malleolus. Place digit 2 just below and in front of the medial malleolus. This is the talus. Place digit 3 just distal in front of the talus. This falls on the tuberosity of the navicular. Digit 4 is placed just distal to the navicular. This is the medial cuneiform. Your 5th digit should fall on the base of metatarsal 1. The shaft of metatarsal 1 is just down from the base and is located between the base and the head. Calcaneus. This is the last of the foot bones to palpate. To palpate, touch the patient's heel. You have located the calcaneus. Posterior leg and plantar surface of the foot. We are first going to locate the gastrocnemius. To palpate, touch the upper mid-posterior aspect of the lower leg. To test, have the patient plantar flex their foot. Soleus muscle. Most is deep to the gastrocnemius, but not all of it. To palpate, go lateral to the distal half of the gastrocnemius. To test, again have the patient plantar flex their foot. Next on the list is the tendon calcaneus, which is the common tendon of insertion for the gastrocnemius and the soleus. Tendon calcaneus. To palpate, go just above the heel, which is the tuberosity of the calcaneus. To test, have the patient plantar flex their foot. Tibialis posterior. To palpate, find the medial malleolus. Tibialis posterior. Find the medial malleolus and move immediately back and slightly up. To test, have the patient plantar flex and invert, sole in, their foot. Hold this spot. Flexor digitorum longus is next. To palpate, go just behind the tendon of the tibialis posterior. To test, have the patient flex and extend their toes repeatedly. Wiggle their toes. You should see the skin move with the toe movement, this tendon should be noticeable in that location. Hold this spot because we are going to be taking a pulse of the posterior tibial artery. Posterior tibial artery, locate by pressing and curving fingertips into the gap behind the tendon of the flexor digitorum longus. You must apply digital pressure for credit on this one. Okay, the great saphenous vein is next. You are going to be tracing the course of this vein. You must begin at the midpoint of the medial aspect of the foot. You must begin at the midpoint of the medial aspect of the foot. Trace up in front of the medial malleolus. Move up the medial aspect of the leg. At the knee, move slightly into the popliteal fossa. Next, angle proximately and anteriorly until you end in the femoral triangle. This vein ends at the femoral vein. The lesser saphenous vein. You are again tracing this vein. You must begin at the midpoint of the lateral foot, just proximal from the head of metatarsal 5. Move behind the lateral malleolus, move up the posterior of the lower leg, and end in the popliteal fossa behind the knee. This vein connects to the popliteal vein. 2 foot muscles will be palpated. The abductor hallucis is first. To palpate the abductor hallucis, place your fingers along the medial aspect of the foot in front of the medial malleolus. To test, ask the patient to move their big toe away from their other toes. They may or may not be able to do this. In either case, you should feel the muscle contract. Abductor digiti minimi. To palpate, place your fingers along the lateral aspect of the foot in front of the lateral malleolus. To test, have the patient attempt to move their little toe, abduction, away from their other toes. Even if you do not see significant movement, you should feel contraction of the abductor digiti minimi. This ends Lab 11 palpation and the lower extremity palpation videos. I would again like to thank the lower extremity palpation video participants, which were Dr. Tom Brazovich, the videographer, Dr. Mike Opelt, depicting the doctor, Dr. Michael Vanetta, the patient, and Karen Anthony, the narrator. We hope you find these videos useful.